Okay, kia ora koutou, welcome back. Hopefully you all got lots of sausage rolls and sweets in the break, and that you took some time to move around the research groups and introduce yourself and learn a little bit about what is going on. In this session, we are having a panel discussion, and I'm personally most excited about this session today because we have a really diverse group of panel members from the community, from industry, from the sector, the partners that researchers within our faculty have been engaging with historically, and I think the wisdom, the experience, the stories that we will have an opportunity to engage with in this session is likely the gold nuggets of today. So I'm super looking forward to this. What I'm going to do, just so that you know how things are going to roll, and actually I have no idea what the time is, so I'm going to task Felicity with letting me know when it's looking like we need to close, if that's okay, Felicity. I'm going to start by getting each of our panel members to introduce themselves and invite them to share a little bit about who they are, their story, their current connections with AUT, and then we have a range of questions for them around how their views and perspectives on how we can work with them to increase the impact of the work we do within their communities and the people that we serve outside of AUT. So I have a range of questions, and we will throw out to the room to ask questions of the panel as well through the course of the session today. So I'm going to start by introducing Rob Small. Rob is here from Ngāti Ōrākei, from the Pourewa garden there, and Rob, I'll invite you to say a few words to introduce yourself.
Nā me. Tiki nā tū rā te pūtaki o nā kōrero e tēnā wānanga. Tiki nā tū rā te hautapu o nā riki kauwhatiti e tani te wānanga. Kei ronge nei rua nuku ki a koe te matapūninga, māngai te matapuihuiho, whakamaua ki a tīna, tomi e hui e,
tai ki e.
Mōrena koutou ko Rob Small, taku ingoa ko Ngāpuhi, Tuturu Māhurehure a hau. I'm here because we've been working very closely with the natural sciences part of AUT at Pourewa Gardens for now going on 7 years, 6 or 7 years. It's a piece of land which, if you know it, is on Kepa Road, just before Eastridge. It used to be the St Heliers Bay Pony Club. It came back to Ngāti Whātua actually at the initial settlement of our Awhi determination, and it wasn't until 2018 that we got onto the land. And the inspiration was to create a garden that would interpret Ngāti Whātua to the world. And in essence, it was a way of bringing back our ahika, our occupation of this land, our right to be there. The land that our people have gardened and walked over for nigh on 300 years. So it was very important for us to look at the project. So there are two things going on that have a link to AUT. The first is that we're developing an ethnobotanic garden which is developed around horticulture based on our tikanga and our Maori science, mātauranga, and also it's based around revegetation of the land. So we run a nursery which produces about 300,000 native plants that have a Auckland provenance a year. We produce about vegetable food for 100 of our whānau families a week, and we're developing a garden around rongoa Māori weaving and our ancestors' production of kumara. So that's a brief summary. Where we've been working with AUT is first of all in a revegetation project, and I should say that one of the most important issues around revegetation of our land is how do we account for the value of a native forest the same way that we account for the value of a pine forest. And I'm talking about how we measure the carbon sequestration. And it is a blight on this country that we're only allowed after 50 years to allow 57 tonne per hectare production unless we cut down a forest and weigh it. So there's a piece of research which is pressing. The second issue for me is how we return to that regenerative horticulture that all of our tupuna used, that the Egyptians used, that the Aztecs used, that all those people used before we started interfering with life cycles and killing the Maori and the Waihanga in our soil. And so for me, the science around understanding the microbiology that's in the soil and its essential relationship with the roots of plants is something that I find very compelling. And from my university days to what I'm learning today, there's just been a quantum leap. Ngā mihi nui, I look forward to talking to you.
Awesome, thank you, Rob. So our next panel member is Stacey Mowbray from Headway Brain Injury, Auckland.
Tēnā koutou katoa, ko maungawhau te maunga, ko Waitamata moana, no tamaki makaurau aho, ko Stacey Mowbray, toku ingoa, nō reira, tēnā koutou. Thanks, it's a real privilege to be here. I think I've just been with Headway Brain Injury for less than 2 years, and one of the real areas of focus for me was to kind of break down the walls that we had maybe created and really reach out and become part of the community. And, you know, connecting with researchers was such a key part of it. Headway was started about almost 45 years ago, and really appropriately for today, was started from a collaboration of researchers and community. There was the world-renowned leading researcher, Dr. Dorothy Gromwell, and she came together with a group of families who were impacted by traumatic brain injury. And I think, you know, from those two different perspectives, they saw that there was a real need for support of people impacted. Recently I spoke to one of the founding members, and she talked about being completely overwhelmed, bewildered was the word she used. Her son arrived home from hospital with a severe traumatic brain injury. He couldn't speak, he was incontinent, he couldn't eat. And she talked about not knowing what to do, having absolutely no idea. And, you know, a couple of years later, she was involved in starting this group with Dr. Gromwell. And she talks about them being her lifeline. She said the group helped to put things in place to survive. Now, 45 years later, things are really different. We have amazing rehabilitation. There's great work happening in all the spheres: hospital, residential rehab, community rehab. But Headway really believes that we want to be there to fill those gaps and to look at, you know, what is needed and to ensure that people don't just survive, but they thrive. And that's kind of what we're really focused on. So today, just really briefly, Headway focuses on supporting those on their brain injury, not just traumatic, but all acquired brain injury. We really believe that, secondly, there's a role for us in educating the community, raising awareness around brain injury so that our community, our society can be more inclusive, less disabling for people living with brain injury. And thirdly, something we haven't been doing, but we really believe there's a role, is advocacy. Fighting for, you know, change, looking at the research and using that to guide us. Briefly, brain injury is a big community. It's one of the leading causes of long-term disability. Just looking at traumatic brain injury, there's, 36,000 a year, one every 15 minutes. I probably pull lots of Alice's research, but, you know, we're all impacted. So many of us are impacted, either directly. By the time you're 25, a third of us will have had a mild traumatic brain injury, and of course, you know, it doesn't just affect the individual, it affects the whānau. So Headway, we are so lucky that we have amazing research happening. Alice Theoden's AUT TBI network is an amazing initiative that obviously you know, breaks down those silos and brings together researchers from all around. And when I was thinking about what our relationship is at the moment, it feels a little bit like we're just sucking everything, constantly asking questions and taking amazing research. We're very lucky that Nicola has just done research around peer support after TBI, which is so important. You know, it's an amazingly strong research area and we're really grateful. And later on I'd like to, you know, we'll talk about how maybe we can give back and how we can be involved. But I'm really appreciative and great to be here.
Oh, awesome. So next up, Rukingi Haupapa, who has come from Rotorua and is here from the Awhi Stroke Trust.
Kia ora everybody. Tuatahi ngā mihi ki a koe Niki. Koe te wai tuatahi te kite te o ngā wahine Pākehā te whakahaere i te karikia. Tīmatatanga. Nā reira, e hari te mea ngāwari. Nā reira, e nui ngā mihi ki a koe. Me mea ka tai mai anō a hau. Tohua mai ki a hau ki a Māua. Te te heo Māua. He nui ngā ringa ki te paku āwhina i tēnei wā. So, congratulations to Nick. When we gather together, you normally start with some kind of acknowledgement or a karakia prayer or something like that. Anyway, I think that's about the first time I've seen somebody from England do that. So, that was damned impressive there. So, well done to you, Nick. But next time, if there's a few of us here, like Ngāti Whātua, e nui nā here, e mihi atu ana ki a koe. Nā reira, ka tai mai te Arawa ki konei, ka tai ka te tiro haere, ko wai i konei. So, tēnei te mihi nui ki a koe. And to all of us that have come. So, I'm Rukingi, I'm from Rotorua. I was a teacher know-it-all once upon a time. And then I had a stroke. A stroke is a brain injury. And my case, it was a block. My family had never heard of stroke. The main thing is that I went to bed and woke up next morning. I didn't know who I am, didn't know who was in the bed with me, and I couldn't talk. So there was a whole lot of things that were crashing all at once. At that time, I was working for the Ministry of Ed, and I was doing a whole lot of things. Where I live. So everything came to a crunching halt. And then we spent the next 6 months, year, for me to try to learn how to talk again. Eventually I could remember enough about education that I thought, gee, I better get back into that damn field. I forgot one of the many things in my life, you know, you all have a bias. And even though I'm an AUT, don't chuck anything at me, but back in the day I didn't actually agree with universities. So I kind of got every kind of tohu, some kind of certificate or something that equates to university. And anyway, that's how I ended up getting into teaching. But when the stroke did hit and my brain started to fall into place, then I ended up going back to university, and luckily I didn't remember that I didn't like universities. And my daughters knew that. They were waiting for me to remember, but I didn't, and they waited until just before I finished. They said, Dad, we just thought that we'd remind you that you didn't like university. I said, oh, gee, why did I not like university? I quite like it. But yeah, there was a whole lot of things in my lifetime back then. But anyway, so university and education became part of the things for me. I finished my Bachelor of Teaching, and then not long later I did my Masters of Stroke in Aotearoa, which is basically the Bay of Plenty, meeting a whole lot of families, me trying to relearn how to socialise with people again. When your world has been flipped and you can't talk, and when you can talk, it all comes out back, front and upside down, the first thing you do is hide. And so the Masters, what I wanted out of the Masters was for me to do my own research, and hopefully some kind of direction will come out of it. And what it ended up with was some pretty clear goals. We needed to form a trust, which is the trust I belong to. and we need to be voices for people that have no voice, like many of us used to. And one of the last parts of that was to connect to the community. I rolled on and did my PhD, and I did 5 years of that, but I'd also forgotten how much energy you need to have to do all of that stuff. And me doing the bachelor, then the master's, then doing the 5 years, I just snapped on the last, towards the end of it. I just had to pull it all together. But because I'd lost my memory with my name, I didn't need another couple of letters to bugger me up. So, I don't want a doctorate anyway. But it led on to a whole lot of other things, and research was one of the many things that I learnt. Most of the people that I run around with who are all stroke survivors and families, they're Māori and PI around the Pacific, around the Bay of Plenty, sorry. And many of them are very allergic to a lot of things, including research. But after I'd just done it with my master's and my PhD stuff, I thought, wow, research is the part of really getting down to the gritty of what you actually need to do. Not just everything you want to do, but what do you absolutely need to do. And so that's become one of the things that we've been pushing our members to get involved in research. Over the years, been involved in quite a few of them, but I've only just had the pleasure to actually receive a finished product from AUT. So Felicity over here was part of our crew. And the thing with the research that's involved with us, it's about sharing the worst times in your life. So why would you share it with a total stranger? And the only way you can do that is if you have a damn good relationship. And so, because we've been able to, we have conferences every couple of years, and Felicity is one of the sharpest people that you can find doing the dishes. But when she's here, she's an associate professor and all that kind of stuff. But when she comes with our lot, she's just one of the same hands that does the same work that we do. And that's how you build relationships. That's how you get people working together. And you can finally come out with a damn resource that we can see. The ones that used to come out with 1 million words that most of ours can't read. So doing that is not helpful. But to get one that's got a lot of pictures, a lot of diagrams, and some good keynotes and references in it, that's about the best resource we can have. And so this has only just come out. I arrived here this morning and I said to Felicity, I want a box of each. They both look the same, but she said to me, I should have one different colours. And I said, no. That's like looking at people. We all kind of look the same, but you've got to get inside the skin to see what's in there and all the things that we deal with in life. And these resources are exactly the same. So I'd like to think that the research that we've just done with AUT is a great example of what we're doing. The ones that you just gave to me this morning, so what we're doing back in Rotorua, so we do volunteer work in Rotorua Hospital with stroke patients and families. And now we're trying to engage them with the health providers in the community. And part of that will be using these. We had our first big gathering 2 weeks ago with 3 iwi providers. And when they sat down, they came because they knew that many of us, they're all related to us, but they didn't know really what a stroke is. So by the time we explained it, they all wondered why it's taken so long for them to get their backsides into gear. And now I'm going to have another meeting with them and they're going to get these back. If you want to know what a stroke means, read this page. If you want to know what the services we receive, good, bad or ugly are, you have a look at this one. And that's where they sit. So the main thing is we're going to use these tools to close a lot of gaps. And that's what I hope we can do with research.
Ngā mihi. Next up is Justin Richards from Sport New Zealand, Aotearoa.
Kia ora Nick, kia ora koutou, ngā mihi o tērā. Ko Springbrook te maunga, ko Nerang te awa, no Aotearoa toku whānau, no Mowbray Australia ahau, ko Richards me Pearson toku whānau, ko Justin toku ingoa. Ko hau te academic lead mo ihi Aotearoa, ko hau hoki te ahunuku kori te nana me hauora mo te renga waka. Nō reira, tēnā koutou, tēnā tātou katoa.
Tēnā koe.
Thanks, Nick, and thanks to those who've spoken before. I'm Justin Richards. Some of the people in this room have heard this before, but my family's originally from Aotearoa, New Zealand. My dad's from Hokitika, my mum's from Wellington. Dad was brought up in Invercargill. They met when they were 16 in Wellington. Met at Victoria University, well, got together at Victoria University after that, and then moved to Australia for a year 45 years ago, and they're still there. They're actually not there right now. They're in Wellington looking after my 18-month-old boy because I'm here. So they've come back over to help out for a couple of weeks down in Welly where I live and work at Sport New Zealand. But I grew up in a place called Mowbray, which is on the Gold Coast. Mowbray means place of sticky dirt in the language of the Yugambeh people, who are the local custodians of the land there. And that dirt was something that was all over me all the time when I was a kid, because I was outside all the time. And certainly the bane of my mother's existence. The role I have now here is I have this role of academic lead at Sport New Zealand. And that essentially has three parts to it in the way I describe it. The first part to it is when Sport New Zealand has a gritty or difficult question that it wants help to answer, I look around to see, well, who might be able to help us answer those questions. And we're often looking at researchers for that. Another part of the role is when there's relevant research happening out in Aotearoa or from across the world that is relevant to the priorities that we're working on, I help create a channel for that research to come in and influence the decisions that are being made. And the last part of my role is to really think about the workforce development that's happening through our tertiary institutions in the country, and thinking about, well, what's coming out of the tertiary institutions when they go through their degree programs and landing in our workforce, and are they fit for purpose for the needs that we've got and what comes up in the sector. So in that, there's a huge amount of interaction that occurs with all the universities, and there's particularly a lot that actually occurs with AUT. AUT is definitely my favourite. I was at Canterbury doing a similar thing 2 weeks ago. I said exactly the same thing. No, just kidding. But it was a similar occasion, and I didn't actually say the same thing, and I don't mind saying this. Actually, the work that AUT does and the interactions that we've had, it's quite distinct compared to the other universities that we interact with. Sport New Zealand itself, and I skipped over this a little bit, Sport New Zealand Ihi Aotearoa is a Crown agency. It's the kaitiaki, the guardian of the physical activity, active rec and play system and sport system in New Zealand. And it has a key role in terms of policy influence across government here in this country. It also is quite closely connected to what's happening on the ground through its regional sports trusts and national sporting organisations. And also one part of the Sport New Zealand group, of course, is the High Performance Sport New Zealand part, which is all about winning gold medals and performing on the world stage. So the organisation itself spans the whole concept of participation and grassroots participation all the way through to high performance sport. Some of the specific engagements that we've had, or we have with AUT, range from sitting in a room with academics and policy people and translating when they're talking to each other but they don't seem to be making sense of each other. I think Simon Walters and Chris Watman will have a good understanding of what I'm talking about there. and other parts of the interaction occurs, for example, bringing in people when we know we're doing some kind of consultation. So Eric has been involved in thinking about some of our futures work. And then actually heavily engaging where we can in projects where we think that research or opportunities will come. And a lot of that's actually come from Te Kakano. And that was an initiative that many of you will know, or all of you might know, that was really led by AUT across the universities, but invited in some of us to be part of that. And it was a really unique opportunity. And from that have come projects. We're working with the Mātai Institute in Gisborne, working in physical literacy, working in play, with all people in here, Scott, Tom, Lisa, Leslie, lots of you have been involved. And then there's a little bit of stuff that happens behind the scenes. I know that there's some really good work that happens around links in with some of our surveys. So some of that work is also going on there. And then the last thing to say is around being well aware of the teaching programs that are going on. And so again, interacting closely with Gay and others here around understanding that and the partnerships that are important to occur there as well. And then there's also a key person I actually do want to mention. Julia seems to hold everything together when I have any conversations with anyone here. So she's a really key part. And I think, leaning on some of the things that have already been said, naming people, the relationships are so important. And I think we'll get into that in a lot more detail. But those relationships are really, really key in that. That's probably enough for me, eh? Yeah.
Awesome. And then last but not least, of course, we've got Sean Gray from Peke, Waihanga.
Awesome. Kia ora, Nick. Inga mana, inga rau, inga rauranga tira mai. Ko Aotearoa, ko Tararua te moanga, ko Manu Aki, whakataka paukai, te Peke Wāhanga. Tēnā koutou katoa. It's a pleasure to be here, CEO of the organisation called Peke Waihanga, New Zealand Artificial Limb Service. We're a Crown entity, somewhat similar to Health New Zealand, and we're responsible for the provision of specialist prosthetic services in New Zealand, and we've got a growing responsibility in and around orthotic services. The organisation has a proud history, so many have come before me. We've born out of the Returned Servicemen's League, so people coming back from wars, groups coming together to support each other, weaving courses, language courses, and provision of equipment and things that help people return back to work. Over the time that I've been involved with the organisation, we've responded to sort of service user feedback, which is wanting more wraparound care. So sort of the one-stop shop, come and get your prosthetics, your rehab, rather than needing to interact with multiple parts of the health system. And we've also got a role to play in the deterioration or prevention of the deterioration of a range of conditions. We've done this with building a strategy with our stakeholders, so our staff, the people we care for, universities and governments. People tend to own what they build, so collaboration in that area is important, and researchers were at the table when we were having those chats. The two sort of ones that I want to point out today is that we do have an R&D strategic theme, and we've also got an expert workforce one, and they all work together to support the service delivery that we provide that has an equity aspect to it as well. Ultimately, this mahi over time has delivered considerable benefits to the people that we care for. So these are amputees and people needing orthotic devices, and a number of our efforts actually have led to quite considerable cost savings to the health system. Examples of that in the orthotic space, if you can prevent an unnecessary ulceration of a diabetic foot, you can save the health system $30,000. If you can prevent an amputation due to diabetes, again, you're going to save around about $40,000 to the health system. And then around unnecessary surgical interventions, there are a range of orthotic options. Again, you're in the 30,000. So you don't need to spend much in our space to get quite considerable improvements. You probably picked up I bring a bit more of a economic lens to the conversation. And so that sort of leads into our initial foray, and if that's the right word, into research with AUT, and probably the one that's had the biggest impact in my time, and my colleague up the back there, Alison, was part of this work as well. It was when we worked with fourth year physio students on the introduction of microprocessor knee technology for amputees. The evidence was sort of there, but it was not particularly strong. This work saw us work with fourth year physio students and to do some quantitative and qualitative research. That research then was presented on multiple international conferences, and it also formed the basis for our outcome measure framework that was then used in the real world prescription approach for this new technology. Subsequently to that and a few other activities, we invested $1 million in upskilling our workforce and buying 50 microprocessor knees for amputees. And as a new CEO that is dyslexic and struggled with the word prosthetist, it was a pretty big move. But as it turns out, it had around about a social investment return of around about $3 million. So for every dollar spent, it returned about $3 million, and it's continuing to add value now. And in addition to that, the outcomes that were achieved based on the framework that we worked up are huge. I've never seen results like it. We have around about 110% improvement in patient-specific functional scores. So that's an important measure for ACC. The next one is net numerical pain rating scale. There's a 30% reduction in those using this technology. And also for ACC, there's an 85% reduction in falls. Those data points all represent quite considerable value to our funders. So my interest in the chat and the bit that I hope to add value is around that translational piece and making sure that there's meaningful thought given to the execution of the outcomes. It's a pleasure to be here, Nick. Thank you.
Awesome. So what I also should have said to you before is that there was going to be a sixth panel member, Lester Levy from Health New Zealand, but he was not able to join us. He has COVID, so we're happy that he chose not to join us today. So now I have a set of questions. I have some questions around building research relationships, some questions around research impact, but also questions around communication and research communication. And so I'm going to direct some of these questions at the panel members, but also then invite questions from you as well in the audience. But maybe, Rob, if I can start with you, with a question around what you see as the key ingredients in a good, solid research relationship.
It's an interesting question because part of the study I did in terms of the Pourewa project, a Master of Landscape Architecture, really was for someone in their 70s. I don't want to do this just to get a ticket because it's not much good to me now, but more to the point that I wanted it to be purposeful. And so I guess when I think about research and the work that we've been doing with Brad and Hannah and others, is really targeted at some concerns that we have of ourselves, but also at projects which I know are of a national interest. So what is the best revegetation technique to use as an example? But also how do we use those things as a continuous learning opportunity, which is what we're doing with the living labs. So I guess it's marrying our ambitions together, but for me, I'm never interested in... I went to a conference once where somebody had written a thesis about the fact that women were more afraid when they walked through a forest on their own. And that might be meaningful, but I thought it was self-evident. So for me, the whole purpose is really to make sure that what we do is practical and useful. And just to, I'm a shy boy, but I'll blow my own trumpet for a minute. It's the first time in the history of Unitec that somebody's developed a master's project in landscape architecture and it's actually been built. So I'm pretty proud of that.
Cool. And Stacey, you know, I guess you have talked about, you know, one of your goals being to start to build relationships with researchers and others outside of Headway. What's your learning from that so far in terms of what you observed, the challenges, the opportunities? Yeah.
That's a good question. I mean, I think we're really at the beginning of our journey. I think there's so much great research happening, and I think that for us, you know, there's probably, we're very clearly non-clinical and we're not researchers. We're very much about being at the coalface and working with our community of people who we think of as experts by experience. So we get a lot of information from them, and I suppose for me, there's been a bit of an understanding that we can't just pick up the research that's been created and apply it. And so I think what we're seeing is that there's amazing research happening. For example, the peer support after TBI pragmatic trial of Nicola was so guiding in everything that we created. But what we actually realised is we couldn't just pick it up and go, impose it on our community, that we actually were really aware that we could take those learnings and all the amazing material that you so generously shared with us, and then we actually had to actively consult with our community about what they needed, what was right for them, and it led to quite a bit of a modification. Initially, I thought, oh, we just, you know, take what the experts say and we put it out there. But, you know, our community was really clear about what they wanted, that for them, one-to-one peer support in traumatic brain injury was not what our specific community wanted. And so it was this really interesting process, that realising we have this great opportunity to listen to the voices of our experts by experience, and that it's this nice, nuanced kind of process that we can use both.
Yeah, cool, nice. Rukingi, you talked a bit about your relationship with Felicity, and nice to know that Felicity picks up a tea towel. I should use that sometime. No, I'm kidding. I wondered if you could talk through how, you know, how we build trust with your community.
Yeah, well, I think if you look back at your grandparents and you think of how they interacted with you, no barriers, you know, and I think that's the ultimate. When you come together, just like with this research we just completed, when we started off, the title of it was Psychosocial Wellbeing. And of course, we met in Whakataane, and it was about 10 of our lot who would rather talk in te reo rather than talk in English, and then to figure out that now we've got to do some research called psychosocial wellbeing. And we go, what the hell is that? And then, anyway, Felicity and Claire and the team BJ, so they, piece by piece, deconstructed it so that we could, and then after about 5 minutes we're going, oh, that's just Ōrākei. Psychosocial is how you engage, and Waihanga is about engaging from God down. You know, just like how we started the day with the karakia you did, just like with the mihi you did. It included a mihi ki te atua. So I just think there were so many amazing things. So as soon as we put in a language that we understand, then the rest just flowed. When it came back, when I had a look at that book, and so I was looking for Ōrākei. Anyway, and that's when what you just said. You know, like we think we are the only ones in the universe involved in this research. So we thought it was going to come out with just our title, our names, and that's it. Only to find that there were 70 of us involved. You know, and you think, wow, you know, that's amazing. So we were just 10 of us, you know, from Whakataane. And so, you know, how you kind of weave it together, it's all that trust. You got to have that relationship, and there'll be bumps along the way, And when you finish and then somebody sees the draft and they go, I didn't say that, I said something else. Next minute the whole world crashes down around our ears and we're all trying to figure out what, who said what? But I guess that's all for me. Anyway, it was just part of us playing on a different field. Most of our members will never want to be involved in research in their lives. Now they're actually having a chance to be involved. And, you know, when I take these books home and then we're going to these different Hauora groups, these health groups, because most of them don't know what a stroke is. And I said, well, here, read that book. That gives you an idea of all the horrible shades of what stroke means to us, with all the different shades of the effects with something that happens with the brain. You know, there's so many things that many of you won't know. You'll only know if you've got somebody in your home who's had one. Then you'll know all the shades of it from morning to night, morning to night. And I guess that's part of this whole of playing this research game. But another thing that's come out from all of between us, I think, is the timing with education becoming more accessible to all. You know, then finding out how huge AUT is during lunch, which I didn't realise how big it is. That's incredible. And with all the different kaupapa that you cover, you know, with research. So, yeah, all you youngies that are sitting up there, some of us, yeah, I was, my doctorate, yeah, well, I was kind of getting up to the mid-60s and I was thinking, oh, am I ever going to finish? But I didn't finish, but I'm hoping that some of you youngies here don't leave it till the last minute to do it. I think that's what Rob said too. We both left it to the other end, you know. The earlier you start, the more you can do, the more you can get involved in, and the world is huge, you know, and even in Aotearoa, the world in Aotearoa is huge, you know, with all the shades of what you can do. So, kia kaha, kia maia, kia tere. You know what that means? Kia kaha, be strong. Kia maia, be brave. Kia tere, hurry up.
Nice. Cool. So Justin, you kind of said a jest a little bit about the translation across the research and the policy table, and I think Rukingi's also just provided a great example of, you know, translation, psychosocial wellbeing, and sometimes speaking a different language. I wonder if you can talk a little bit about, you know, how we talk across those different spaces, different disciplines, you know, research, academia to policy practice.
Yeah, it's amazing how many times, I mean, this was a really good example where we're talking across languages, so te reo Māori and English, but it's actually amazing how many times when we're all speaking in English and we're kind of saying the same thing, but we don't realise we're saying the same thing as each other. And it's amazing how many times we double down on what we're saying because we don't think the other person's quite understood. I don't think you quite get it, or I'm not explaining myself clearly, or whatever it might be. And then the other side doubles down too, and actually what happens is you get further and further apart when you need to be coming closer and closer together. And having spent some time, when I introduced myself, having spent some time in the policy space, and also some time as an associate professor at Vic Uni, I'm in the fortunate position where I kind of know the pain of both sides and the benefits of both sides. And the joke, the jest that I made earlier was when we brought together our sport development team at Sport New Zealand and Simon and Chris on multiple occasions to talk about common work. And what was clear looking in was the amount of common ground that was there and the opportunity that existed. Yet at the end of the day, I would get a call directly from Simon. It would be a race who would call me first, Andy and Alex or Simon and Chris, to say, I'm not quite sure, did we connect there? I'm like, yeah, you're saying the same thing. We've just got to bring this together and we'll get there. We've just got to keep going. And it's it happens all the time. And one of the things which I think in academia we're particularly guilty of this is when we talk about relationships. We use different words thinking they mean the same things when they have very distinct meanings. And I learnt a lot about this as I was going through the Sport New Zealand cultural capability training that I was exposed to when I first arrived and is ongoing. And I was shown and learnt about Māori engagement model. And it talks about this idea of, well, there's different types of engagement. And you can inform, you can consult, you can collaborate, you can co-design, and you can empower. And we use some of these words interchangeably. Oh, we'll collaborate on that in partnership. And they actually mean different things. And it's really important that we recognise they mean different things. It's also really important that we recognise that not one is always better than the other. We're always, the buzzword becomes co-design, and so we're all going to be co-designing. Sometimes co-design is not appropriate. Sometimes co-design is not the right way to go when we're working in partnership. Sometimes we're in a place where we actually just need to be consulting or collaborating, or we need to step right back and go, empower, off you go, you lead, you do. And I think getting clarity on those differences and then owning what those differences are and knowing that this is what we're doing and there's reasons for it, and in all the people in the room being comfortable that, okay, we're working in a collaborative space here, okay, we're working in an empowering space, or actually, no, we're just informing here, is really important in terms of actually bringing those conversations together and people understanding the differences that's going on when people are saying the same thing but they're just using slightly different language or a completely different language.
Cool, awesome, thank you. Sean, sorry, I keep leaving you till last. We might have to start with you next time, hey?
It's all good.
I wonder if you could share any reflections on some of the biggest challenges that you see in building relationships between researchers, academia, and community industry organisations. And I guess you can talk from the health sector or whatever perspective you want to put on the table.
Probably some thoughts in and around relationships, not to overcomplicate it. Yeah, there's two peoples or two organisations that need to talk to each other. You started touching on message sent, message received. Stuff, it's simple. It's about actually just having a conversation. Justin mentioned earlier about the Te Kākano thing, and I was thinking about, as you're talking there, it's probably been the most inspiring piece of research activity I've been involved in, and it's because it created a common language and a common understanding with some really awesome Māori philosophy in there. I'm born in Ōrākei, brought up and live in. Thought I had a pretty good understanding on culture. As it turns out, I don't. Especially Māori culture, I've been really enlightened through that. So the question around relationships is there. Then sort of the barriers or sort of the opportunities. I think there's in health, so I run a health service that provides specialist devices. There's a lot going on at the moment, so I too was interested to hear what Lester had to say. And so I'll follow up with him later. But I think that given the quantum of change that's out there and there's societal challenges, the maths say that there would never be enough GPs, there's not going to be enough hospitals, these things are existential challenges for us. And so when I look at clinical practice, it's embedded continuous improvement. It's a really important part of your quality framework. But the incremental improvement that you get is possibly not what we need for the health system now. So the barrier or the opportunity for researchers at the moment is actually to think bigger. What is the platform paradigm shifts that need to happen that then are going to have some pretty well thought through execution at the back end of it. And when I was talking to Erica today, that execution piece, you've spent all this work in mahi getting to a point and then it almost feels like it goes on to a shelf. There almost needs to be like a business consulting group that works out how to execute that research into deliverables. So I think for me, the biggest challenge is actually how do we realise the value of the mahi that's done in a more meaningful way. And that may be that you need to have more business considerations. You know, in a health system where there's no more money, what are you going to substitute? What are you going to eliminate? And what's your percentage confidence that you're actually going to make this stick? Because, you know, I might think it's a good idea, and a handful of us might think of it as a good idea, and in a really controlled environment, it looks like a great idea. But in the real world, you have people that don't turn up for appointments. So if they're not there, you can't sort of do the application of the research.
Great, thank you. So I might take the opportunity to throw it out to the audience, to give people in the audience an opportunity to ask a couple of questions before I dive in with more. So raise your hand if you want to ask a question, and we'll make sure a microphone gets to you. Microphone coming.
So I think one of you mentioned this earlier, that it's really hard for people to get involved in research. They've got enough going on in their lives, you know, particularly when you have a stroke or a brain injury. You know, it's a really challenging time. And I just wondered if you had any thoughts in any of the areas that you're all involved in terms of how do we work with communities to see the value of research? You know, I know we've done a bad job in the past in terms of connecting with community. You know, we're trying to do more in that space now, but how at a more general level can we sort of raise public awareness about, you know, research is different and we want to work with you? Any thoughts there would be really appreciated. Thank you. Mihi.
That's a really good question, and I think part of that is that academia probably needs to reach out, and an early part of my experience was working with Professor John Crompton from Texas A&M University, who's an absolute guru on tourism and sport marketing. And what he did is he reached out to the parks manager of Indianapolis, and they worked through a whole lot of models about equity and pricing was one of the issues. So I just mentioned that because you know how litigious the American society is, so that led to people saying, well, we need a bigger piece of the pie. And I think one of the things you notice in Aotearoa is that we spend a lot of money on sports fields for a relatively few people. At least that's the impression. But when we understand the followership, I guess it begins to make sense. So it's easy to jump to a soundbite instead of understanding the whole picture. And if there was some solid research behind that, we might understand it better. So the first thing is reaching out. The second thing is really to think about the innovators and what they're doing and connect with them and create a relationship first. That would be my advice.
Can I just add to that? I think that there's amazing work happening, and I think that if we're really clear that the purpose of research is to drive change, and that our communities understand that, and then they're involved from day one on what change they believe is needed. And I think if we start there, I think Leslie talked about action research and getting in there really early, so that rather than, you know, the research being altered to be applied to our communities, if we can get from them what they need, what the gaps are and what their hurdles are, and use that to guide the research that then leads to the change they deeply believe is needed, would be really powerful.
Any other questions from the audience? So Leslie has a question, Tula.
I'll just add to the previous question though, Nick.
Please do.
I'm probably just thinking out loud, I heard the comment that not done it particularly well or done it bad. You know, it's a journey, and so I actually think the essence of the conversation is that it's just, you know, improving that conversation over time. And to the point, it's actually starting the chat early. And the earlier the conversation, then people are involved and own what they build. As we're hearing here, we've got some wonderful resources that have basically been bottom up with a good framework of thinking. So, you know, get in early.
Yeah, I was as an old-time teacher, I was thinking, you know, like research at the moment, it sits with masters and doctorate, because when you do the bachelor, it's everybody else's research. And so the way it fits at the moment, it seems to be up at the tertiary end. And I was just thinking, like when I was teaching in high school and further down, and I was just thinking there's a whole different, maybe our kids should be having a look at lower level kind of research, just playing with it. It's always seems to be left up at the other end of the education journey. Maybe if it was sooner, then maybe it wouldn't such a scary laden topic by leaving it up that end. If it happened a lot earlier, then maybe it can be. But like at the moment, we've got people who have had brain injuries trying to be involved in research, and a big part of that is why. Why should we? And one of the reasons we do it is the more we talk about our own stories, it kind of helps our own rehab. The more we talk about the bad times, the sad times, the horrible times, it gets easier and you can kind of let those times go. If people don't have that opportunity, then it's always stuck. They're frozen in time with that right in front of them. So that's one of the reasons we use the research as part of their own healing journey. So it comes back to the purpose of the research. You know, you've got to be quite clear of the why. With us, it's easier with our lot. We just need to be able to get past our trauma to move on and have life. Yeah.
Cool. Leslie.
Kia ora for that. Just connecting what you said with the previous question and also the thing I was interested in. I see Sean and Justin, and I know Rob from way back, but I've come to meet you two now for the whole panel, so all of you. I see Sean and Justin, as I've come to know them, as our plants within the organisations that they work within, Artificial Limb and Sport New Zealand. And I see the power that they have of influence within those organisations to help be the champions of the value. And so my question is around the role that you probably already do, but what else do you think you as insiders can do to help create a coalition of a greater coalition? So, because I also see you as kind of isolated in the way that you see value from the research community. You're unique. I see you as unique, Sean and Justin. And I think that's a shame. So how can we build more of you? AI?
No pressure.
You're up, mate.
I want to become a big kauri tree. How can we help? Well, firstly, you already are. I love working with yourselves, and the Te Kākano stuff, as you can tell, has had a big impact on me. What my aspirations for our organisation are, though, we've just implemented new software, and so this will probably put you to sleep. But in there, and it went perfectly. Just ask Alison. We had no integration issues. It was magic. We've come out the other side of it, and I'm hoping that we will have real-time data when we have, and we don't have it yet, but the team will be able to put in outcome measures as part of their clinical practice to do the prescriptions or to support the patient's journey, all that type of thing. But we will have real-time delivery times, outcome measures, patient types, you name it. You can slice and dice it whichever way you want, and if you want to do research with us, here's your username. Get in there and knock yourself out, you can't break it. So for me, I would love to think that we're in a place that you don't have to duplicate surveys, questions, and then when you have done your piece of work, it ends up as a report with some paper-based forms that, again, the clinicians need to fill in. It's just integrated and seamless, and so we don't actually drop the ball and stop. It's just seamless. It just continues as improvement.
Yeah, I'm reflecting on what you've said, and there's a particular thing that keeps coming up in my mind. We very recently, and he won't mind me talking about it, very recently there was an academic from the University of Waikato who applied for a job at Sport New Zealand and got it. And came in, and he's come in sort of a mid-level Sport New Zealand bureaucratic role. And it was seen by many as a victory, as in we've now got another plant inside of Sport New Zealand. But it was actually seen by some of the more, what I would say, the more progressive thinkers within Sport New Zealand is, isn't it a shame that he feels like he has to come here to have an impact? And I think that's a really interesting point, because perhaps what I'd throw back at you is, wouldn't it be good if we didn't need to have plants? And what could we do to actually shift to a point where my role, Sport New Zealand, was essentially redundant because of the way we worked in with each other, and we didn't need a channel as such to make it happen because it was happening automatically. Now that is a long way away, and that's a dream that I certainly have, but I think that we probably need to, just reflecting on this, we need to shift away from this idea that we can have a plant, because even when I talk about the bits that I'm involved with, I didn't mention any of the people in this room who are interacting with High Performance Sport New Zealand, because that's Glenn Carney's space, and that's what he does in that, and he's the plant in that space. And we're always limited by that as opposed to the broader engagement and the broader connections that we could have. The answer, I'm not sure. I think we're on the journey. And it's just a continuous flow of relationships and more of them, and connections and networks. Something that, again, Te Kakano really helped us start.
Nice. So I'm mindful that I have at least 1,000 questions I would still like to ask, but we have about 7 minutes left of our time. So we might have to continue the conversation out over food and drinks. But I wondered if maybe to finish us off, I could invite each of you to share, one or two key things that you think you would like to leave us with when we're thinking about how researchers can connect with community, industry, organisations to have positive impact on the world. So maybe one or two last words of wisdom from each of you, and I promised I would start with Sean this time, so we'll start with Sean.
Excellent, thank you. Or for me, I just think big. The health system needs really good thinkers to come up with new ways of doing things. And the other one would be how you question or frame your research. In coming here, I was reflecting about the role of telehealth. The research I read in and around telehealth is how can it be complementary to existing models of care? Why not flip the question around and say it's telehealth unless justified otherwise? And if you look at it that way, I already know that within our service, there's a range of opportunities. We're not ready for some of them, but it definitely changes the way you think about how you might frame your research. So those are my two for the day.
Cool. Justin.
First one, I'd lean very heavily on, I told Leslie in the break that she stole my line this morning around academics often feel, and they play a role of being a critic of society and the conscience of society, and that's important. It's really important that we don't think that the only way we can do that is from being outside the tent. And actually, being on the waka and being inside the tent sometimes provides a whole lot of additional context, which means that things and understanding of what's actually really going on changes, and the value from that comes. There's nothing more damaging for the role of academia inside of Sport New Zealand is when an academic has gone and felt that they've been an investigative journalist or some kind of detective and felt like they've discovered something, and then all of a sudden we hear about it in the media, and actually it's something that we've been actively working on and we'd actually love some help with, and we know about it and we want the evidence to help us fix it, but it's sort of now being a damage control situation rather than a productive problem-solving approach together. So that's probably the key thing for me, and I'll leave it there.
Rukingi.
Yeah, just following on. I think research in the communities, you've got to get out of the tent. Just like what you've got on the panel here, you've got a whole lot of mixed worlds right here. And the great thing with that is that you will have a lot of different thoughts coming in. If you've got everybody on here has got the same everything, then you get what you get.
The same.
You know, it's so predictable. So, so I think that just looking at the mix that we have here, I think there's a perfect mix. The interesting thing for me is we've actually got a gardener here, and all I've heard about is all of these kākano. And plants. Kākano, say that word? Kākano.
Kākanoa.
A kākano is a seed. You've got to plant a seed, and then it grows. And but you have to feed it and treat it. You know, all the things that gardeners do. So isn't it ironic? That's what we've got here. We've got a gardener going on here. But that's But I think it's about that diversity. And this forum is a good place for the base, but you've got to get out where the people are. And that's when you get all the different whakaaro coming in, all the different thoughts. Yep.
Just really reiterating what's been said. I think the value of getting in at the earliest stage with our communities, valuing and elevating that lived experience and having them help guide you around not just being involved, but what you're researching. And I think, that's what we hear again and again. If people see the value in it, certainly our community will want to be involved. And then I just had, one final thought really around, I'm not even sure I made it clear that we are a little purpose-driven, not-for-profit. And I think one of the advantages to that is that we can play a role in disseminating the research that is coming out. And we can perhaps be a little bit controversial, or we can get out there and maybe present it in some ways that, tertiary institutions and researchers can't. So, we're quite keen to play that role as well, because I think sometimes, there's more restrictions within a university. So, let us cause some trouble.
Oh, I think we should take them.
Well, the gardener's point of view here is a couple of things. One is, it occurs to me that in the work you do, who do you see as your client? And there's a number. Society is certainly one of them. But for me, in each of your disciplines, you must understand there is inevitably professional bodies that have a strong relationship with the research you do. I wonder if a way forward isn't to say to those institutions, can you, with your membership, frame up some research questions? And then, because I've been involved with this in a number of cases in my career where universities have come to us and said, we've got a master's student or a PhD student who wants to do a certain thing. And that's most often the institutions reaching out. But I wonder if there shouldn't be a conversation with some of those client groups of yours to say, what are some of the burning research questions you have? Because that's when the rubber will hit the road. That's when that research will be truly meaningful. And I couldn't sign off without acknowledging a particular research methodology that applies to Te Ao Māori. And that is kaupapa Māori rangahau, which is research by Maori, with Maori, and for Maori. And that has arisen simply because there have been so many untruths perpetuated against our race, including the warrior gene and other things I could mention. So it is really important to understand the constituency that you're actually researching and marry both your, I guess, your matapono, your values with those things. Thank you.
Awesome. So that brings us to the end of this particular panel discussion, but I hope that we all can continue the conversation, both here today in the Tuki building, but out in the community and out of the tent with all of these contributors today. I would like to thank you with a wee gift, so 2 moments. they get a more special gift than our internal presenters. Not to say that our internal presenters are not worthy of the special gift, but these people are extra worthy. Justin. Sean.
Kia ora.
Stacey. Rob.
Okay.
And Rukingi.
Kia ora.
So that is really just a small token to acknowledge what you have shared with us today so generously. Ngā mihi nui kia koutou. Very grateful for your time and energy and wisdom and stories and experience and everything else that you brought into the room today. Just to close us off briefly, I have someone's bus card here. If you're if you've lost a bus card, I will put it at the registration desk just in case. A seed, seeing as we have used a lot of gardening analogies today, for anyone who's doing Research Roadshow bingo today, just a little clue. I did room service as a master's student, saving money to go overseas. Not sure if that rings any bells for people trying to fill bingo squares today. And finally, we are moving to some food and drinks, but I just wanted to let you know we will be back in here for the next presentation session by 2:30. So I look forward to seeing you there. But before we finish, one more round of applause for our panel guests.
All right.
Very much. Super.